I want to introduce myself. I'm Bobby Cagle.
Nice to meet you.
Nice to meet you.
Bobby Cagle runs the nation's largest child welfare agency, the Los Angeles County Department of Children and Family Services. He had been on the job less than 7 months when tragedy rocked the agency he had been chosen to lead.
Although Anthony survived through the night, tragically, he succumbed to his injuries at 6:30 the following morning.
Personally, I feel this in the deepest part of my soul when a child dies. And because of the commitment that I chose and the work that I do, the life of a child is the most precious thing there is. And so we're trying to really use the kind of grief that comes on our end to spur changes that will help us avoid these type of things in the future.
He initiated an enhanced operations plan to address systematic problems. It includes an immediate review of cases to look for potential trouble spots and make sure child safety is paramount.
We're doing over 1,000 case reviews right now. Those case reviews will tell us several things. Are we doing good work? Are the plans that we're establishing for families the ones that we need to be? It will also give us an opportunity to make corrections if we find issues.
He's also meeting with frontline social workers to find out what's working, what's not, and what's needed.
Good afternoon.
Good afternoon.
The second thing that we're doing, I think, is really an essential part, which is talking to our frontline staff in focus groups, making sure that we understand from their perspective the things that are problematic for them as social workers, but also the things that they may need from the department to be able to do their jobs effectively.
Cagle is also drawing on expertise within the county to analyze cases and improve the system.
One of the things that we're looking at in here, and you'll see in this plan, is around how we do better multidisciplinary teaming.
That means working with the Office of Child Protection, the Department of Health Services, the Department of Public Social Services, the Sheriff's Department, and the Departments of Mental Health and Public Health to identify best practices and established shared policies.
Because now we've got the baby safe. I got to worry about your safety because you don't know what's in the room.
Training is key. For the past 5 years, this simulation lab has given beginning social workers a chance to experience real-life situations they will encounter in the field. Cagle, who formerly was in charge of Family and Children's Services for the state of Georgia, says the SimLab, as it is known, is an innovative model with real-life benefits. He says other kinds of enriched training are also needed.
How could we ask a question to make sure we're not making assumptions about things?
Part of the training is recognition that classroom is not enough. Classroom can give you theory, but in practice, you have to be able to translate that with families into development of relationships. This is unique. There are very few of these in the United States, and this is something that we should be very proud of. But at the same time, we're also going to be looking holistically at our training program to assure that we're doing the very best that we can.
His almost 3 decades of experience in child welfare bolsters his strategy to improve the system, but it's also his personal background that gives him unique insight on how he approaches his job.
My history includes being born into the child welfare system in North Carolina and living in an orphanage in that state for the first 10 months of my life before being adopted by a wonderful family. And that all took place with the help of a social worker. My career vocation choices have always been guided by my experience.
That life experience has also shaped his goal to create a more inclusive foster care system for LGBTQ youth. As a gay man, he understands firsthand the issues they face. With nearly 1 in 5 foster youth identifying as LGBTQ and research showing they are more vulnerable to poverty, homelessness, and justice system involvement, his plan also includes creating a specialized section to focus on their needs. The Los Angeles County Board of Supervisors has made reform a high priority. Supervisors recently voted to immediately implement a wide range of system improvements, including retraining social workers in structured decision-making, providing additional monitoring after families have concluded voluntary maintenance programs, assessing staffing resources needed, and exploring a mentoring program to pair seasoned social workers with new hires. Cagle knows there's a lot of hard work ahead, but for him, this is not just a job, it's a calling.
I was a child in an orphanage at the first part of my life, but my life was changed by a social worker. That's what I want our workers doing, focusing on providing change for children and families that will lead to the kind of outcomes that we want for all our children, to be happy, to be healthy, and to be prosperous. And if we can do that, that's when we're successful.